everyone, I am Kathleen Joy P. Ronquillo, your student nurse from Davao Doctors College, and for today's video, I am going to do the pediatric resuscitation, which includes the infant and child. Now, so we're going to do the pediatric resuscitation. So this involves a child or an infant who needs immediate resuscitation. So this basically the steps in doing the procedure, just the same with the adult CPR. The only difference that the number of hands or fingers in the chest compressions. So we have to check for the environment and we have to make sure that the scene is safe. And the next is we have to check for the patient's level of consciousness, and if the patient is not responding, then we'll have to activate the emergency response system. Baby, can you hear me? And the next is we have to call 911 for emergency. You, sir, in white shirt, call 911 immediately. We have a patient here in need of help. Right after that, we have to check for the patient's ABC. We have the airway, we have the breathing, and we have the circulation. So we'll have to open the patient's airway. If the patient's wearing constrictive clothing like this, we'll have to loosen it up and tilt the head, chin lift to still open the airway. And then we have to check for the patient's breathing using the look, listen, and feel method. And the next is we have to look for chest rise and fall. We have to listen for breath sounds, feel the for respiration of air. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then we have to cover the patient's mouth and nose using the face mask, and we have to deliver 2 rescue breaths. And then right after that, check again for the patient's breathing and pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And as I can see that the patient is not breathing and has no pulse, we have to proceed with doing the cardiopulmonary resuscitation or the CPR. So if the patient is infants are with the age range of 1 month to 1-year-olds. And in order to deliver chest compressions, we have to use 2 to 3 of our fingers where we locate the lower breastbone of the patient just below the nipples, and then start chest compressions at the rate of 100 compressions per minute. So we have to put fingers there below the nipple. So assuming that this is the nipple part. Okay, 1, 2, 3. Begin the chest compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then 2 rescue breaths. The next is we have to do these chest compressions and rescue breaths until the help arrives or until the next responders arrive to take over. And then we have to make sure that there's a complete chest recoil and the depth of the compressions is only at 1 to 1.5 inches, because we don't want to fracture the baby's bones. Also for every rescue breath, there should be a visible chest rise. Now next is if the patient is a child, so the children are within the age range of 1-year-olds to 8-year-old, and we still have to perform the chest compressions using 1 hand. So we have to place the heel of one still at the lower half of the breastbone and give the patient 30 compressions to rescue breaths. Then begin chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then the depth of the chest compressions should be at 1 to 1.5 inches, and then give the patient 2 rescue breaths. And then right after that, we have to continue doing the CPR for at least 5 cycles, and then check for the patients for any signs of circulations. So assuming that I already done performing 5 cycles, 5 cycles of CPR. And then we have to put fingers on the chest, and then we have to check for breathing, for any sign of breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, if the patient has already returned circulation, we have to place the patient in the recovery position. So we have to place the arm that is nearest to me in the right, and then we have to grab the hand, assuming that this is the hand, at the farther side, and then we have to place back of the other hand on the patient's cheek, and then we have to hold it there, and we have to grab the leg. I mean, we have to grab the further knee and then flex it and grasp the leg to roll the patient to the side, or to the side that's the recovery position. So this is the recovery position. And then right after that, we have to wait for the rescuer responders, and then we'll have to document all the procedures done. That's all.